If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you. Everybody, welcome. It is another episode of Talking with Dr. Donna. Remember, you always have an appointment with your doctor every Thursday, 6:30 p.m. We are coming to you live tonight, and I am blessed to have Pastor Michael Wallace here with me tonight to have a conversation with clergy about coronavirus, how it's impacting our community. So, talking with Dr. Donna, you know, I am your host, Dr. Donna White Carey, and my goal is to build generational health. And what does that mean? That means we are going to reimagine what it looks like to be healthy in our community. That means we don't want to have generation after generation having diseases passed down that are going to impact our lives, shorten our lifespan, and cause complications. So that's what we're about here on this show. We want to make sure that we are a trusted voice for you in the community to ask questions, to hear answers, particularly as we're in this time around coronavirus. So let's get into it. Hello, Pastor Michael Wallace. How are you?
I'm great tonight. Thank you so much for having me, Dr. Donna.
All right.
Honored to be here with you.
Great. Thank you. So why don't you tell us a little bit about yourself and your church?
Yes, hi. I'm Pastor Michael Wallace. I pastor the historic Mount Zion Missionary Baptist Church right here in the city of Oakland, in West Oakland. And I've been here now for 13 years. We are a church that's trying to transform our community to a plethora of ministries that have a direct impact on our people right where they are, minister to the total man and woman within our given area.
Great. And you have really taken a front seat to what's happening with coronavirus and helping out the community. Can you tell a little bit about how your church has been involved in the community around coronavirus?
Yes. With respect to coronavirus and the pandemic that we are currently experiencing, we have basically expanded our community outreach ministries in that every week on Thursdays, we provide over 250 boxes of fresh food and vegetables to individuals within our community. In addition to that, we also are a host site for free COVID-19 testing, in that individuals can come every Thursday between the hours of 10 a.m. and 3:30 p.m. and get free testing for COVID-19. You don't have to have an appointment. You don't have to pre-register. You don't have to even have insurance. Just come and we will make sure you're taken care of. We have both a drive-through as well as a walk-up. And typically people are in and out within 10 minutes. On average, we serve about 250 to 350 people every Thursday.
Wow.
Providing these tests. In addition to that, you go right across the street to our warehouse and we're able to provide you with free groceries for you and your family. We also are partnering with Masks for the People, in which we have given out over 25,000 masks during this pandemic, free to our people in our community. During the Thanksgiving holiday, as many are aware, we gave out 1,200 turkeys, 1,000 bags of groceries, and we also provided 1,000 masks to the people during the Thanksgiving season. For Christmas, during the pandemic, we understood that many families were struggling and were dealing with some very difficult days and challenging times, financially and emotionally. And so we tried to assist in that area by providing toys to hundreds of families during the Christmas season, as well as to target those who are a season of peace in collaboration with Pastor Michael McBride and the Live Free campaign under PICO, California, as well as PICO National, in which we provided food and toys to hundreds of families, those who were part of the ceasefire program, in which that is a violence prevention program that we introduced and are implemented in the city of Oakland And so we are collaborating and working with a number of other like-minded faith leaders to make sure that we minister to our people in the midst of this pandemic. We have partnered with Bishop Keith Clark, Bishop Kevin Barnes, of course, Pastor Zach Carey, Pastor Michael McBride, Pastor L.J. Jennings, and others, just so that we can meet people right where they are and let them know that we as the church and we as the people of God and people of faith are here to help them, assist them as we all press through this pandemic.
That's awesome. That is awesome. That's great, because it is going to take a partnership with all of our churches to work with the community. We know that we are trusted members, are having, trusted leaders in the community. Our pastors are, I tease my husband all the time. I say, if I want people to hear the message, I tell him to say it.
That's right.
And then he will say it, and people will be like, "Oh yeah, Pastor Zach said." It's like, yeah, but that came from Dr. Donna.
Well, let me say, Pastor Zach is a strong voice in our community, because every week, not a week fails, that someone will come to our food pantry and say, "Pastor Zach sent me."
That's right.
And they come, and we make sure that we take good care of them, and we thank and appreciate Pastor Zach for partnering with us. He has been, in all candor, a strong supporter and a great partner and a great inspiration for me personally.
All right. Thank you. So I wanted to say a little bit about why coronavirus is so important. Why are we even talking about it? What are we doing? So I want to put up the slide that shows where we are to date with our cases and our deaths. And this is really for Alameda County. And it shows where we are right now in our county with the number of cases, people who are testing positive. You have a testing site, and what we're looking at. So what are we looking at? So if you see here, you see the number of cases that we have. We are over 63,000 cases in Alameda County. That's 63,000 people who have tested positive for coronavirus. Almost 800 people have died in our county from coronavirus. That is a lot of people that are impacted by the disease, that are sick from the disease, that are dying from the disease. If you look at the number of two things I want to point out to people and have people recognize. Number one, the highest number of positive cases are in the age group of 18 to 30. So you can see that blue bar there that's extended out. Over 16,000 cases are in our young adults, 18 to 30. And that's probably even higher because not all of them are getting tested, right? So these are the people who are being tested that are positive, over 16,000. And the number of cases higher is in the Latin community. So the Latinx community has the highest number of cases. It's highest in our 18 to 30-year-old youth. And the slide that I don't have to put up is to look at the number of deaths and hospitalizations. That's impacted. That's where the Black community is impacted. We are impacted by our deaths. We have the highest rate of deaths in our county, almost twice as high as any other ethnic group. And we're being hospitalized at a higher rate. Are you seeing that impact? Are you hearing that in your church community, in your church congregation, and the people that you're seeing? Are you hearing that about our young people and who's impacted with hospitalizations?
Yes, no, you're absolutely right on target. We are hearing, and I get data reports, analytical data each week from the individuals that come through and get tested. And what we're seeing at this particular site is that 64% of the individuals that come and get tested are African American descent. The next highest group that we test weekly is of the Latino community. And then in the last 2 weeks, those of Caucasian numbers have quadrupled as far as individuals coming to get tested. Mm-hmm. But what we're finding is that we have like over a 7.5% infection rate.
Right.
Which is yes. And what we're finding more so is that infection rate is in that target group, age group that you just mentioned. And so what we're concluding is that many of our young people are getting testing positive, and many of them are taking it back home to their parents, their grandparents, and other seniors in their environment. And those are the individuals that are becoming gravely ill, and that's where we've seen a high rates of infection, hospitalization, and extended stay in hospitals. And so it's very important to me that we have to do a better job of getting our young people tested so they can know early, so that they can be aware of it and conscious of it, that they don't go and spread it to others within their immediate and extended families.
Right. And I think so important for us, for me as a physician, for you as a community leader, and I like to call the pastors our amplifiers, right? Because we as the medical professionals will give the information, but who they listen to and who we can amplify the message are pastors. So that's why I'm so happy that you're here tonight to amplify the message of coronavirus. I want to put up another slide of we know that there's many ways to prevent the spread of coronavirus, right? There's ways in which we can prevent people from getting sick, right? Wearing a mask, right?
Yes.
Wearing a mask is so important. So I'm so happy that you're also distributing masks
Yes.
at your site, because we know the mask will decrease the risk of infection from me spreading it to you. And then if you have it, from me getting it from you. Standing 6 feet apart or more, right? 6 feet is sort of an arbitrary number that we picked up, but we know 3 feet or more our aerosol or respiratory droplets don't go that far. So 6 feet is a really good distance.
Yes.
We also know staying away from crowds, right? That's not fellowshipping, not hanging out, not going to parties, not having baby showers, not having birthday parties. I know it's hard out there, folks. I know you want to celebrate, but this is not the time. You see 64,000 cases, 800 people are no longer in someone's family, brothers, uncles, aunts, cousins, grandparents, right? Washing your hands. And the other way that we now have to decrease the spread of coronavirus is the vaccine. So I know, Pastor Wallace, you have heard people talk about this vaccine. What are people saying to you about the vaccine?
Well, number one, within our community, the biggest drawback for most African Americans is the fact of trust. Dealing with the trust factor in light of the fact that many are aware of what happened with the Tuskegee experiment. Many don't have a lot of confidence in our government to administer this and trust what they're doing in light of how vaccines has been misused in previously or historically. Secondly, you have many who are just really are afraid that this is another ploy to commit genocide within our community. And so then there's some who just saying, well, hey, I'll probably do it, but I want to watch these first group of people go through it. So
Right.
There's a lot of mistrust. There's a lot of concern. And we definitely need to get more information and educate our people. And at the same time, so people can make informed decisions.
Right.
That's, I think, the critical point right now. People want to be informed, get proper information so they can make informed decisions.
Right. And I completely agree with you. Can you put the distrust slide up? I think, when the vaccine first came out and we heard lots of people saying, oh, Black people don't want to take the vaccine. They don't want to take the vaccine, as if there is something inherently wrong in our community. And so I have been reminding people that the reason Black people don't trust the medical community is not anything inherent to Black people. It's inherent to you scientists and me as part of the health professionals, right? The medical doctors and the scientists who misused our bodies and mistreated us for centuries. And it did just start with Tuskegee. I know Tuskegee is sort of what everyone knows, but it started many, many, many years prior to that, during slavery. So we are justified in our distrust of the medical and scientific communities. So for me, since I understand that, I think that exactly what you said, we need to educate ourselves. So I want to give a little bit of an education about the vaccine, what it is, and hope that you can then amplify this message of the vaccine. But I first wanted to just set the tone that I understand why people weren't running out to get this vaccine as soon as it came on the market, because we have a history of being misused and abused. But having said that, once we understand and we have the information, it takes doctors who look like the community to talk to people and hopefully give information that will set their minds at ease. So indulge me a little bit so I can talk a little bit about the vaccine, give some information, and hope that that helps people to understand. So first of all, let's put the slide up talking about the vaccine and DNA and RNA and the protein. So if you think about the vaccine, both vaccines that are available currently, the Pfizer vaccine and the Moderna vaccine, those are both vaccines called using mRNA or messenger RNA. It's not the DNA, but it is it's a messenger for genetic material, right? DNA is like your storage. It's your entire blueprint of your body. It has all of the instructions that says, Pastor Wallace is going to have brown eyes. Pastor Wallace is going to be, 6 feet tall. All of that genetic information is in your DNA. That's the storage area, right? It's for those of us who like computers, right? That's your storage. Your mRNA or your messenger RNA is like the software, right? So it delivers the message of the storage. It takes some of that message and then is going to carry it out. So it gives the instructions, right? And then the proteins, which is really the important part, the proteins are like applications. If you think about the applications on your computer, right? You can do many different things, many different applications on your phone or on your computer, and they each do different things, right? You have a banking app, you have a game app, you have where you can play cards on, whatever, all these different applications. Those are the proteins. Those are the ones that are really doing the work. So these are the three basic things that you need to know about in the vaccine. Now, let me show you how the vaccine actually works. So let's look at the next slide where we're showing the picture of the vaccines going into your arm. So the vaccine itself is created by the messenger RNA. This is new technology for this type of a vaccine. It's not new technology completely. It's been used in many different other areas, but this is the first time that this type of technology can be used in a widespread vaccine. So that's why we were able to make the vaccine so quickly, because the technology already existed and was being used in cancer treatments and treatments for immune diseases. Now, here came the opportunity to use the same type of technology in a widespread vaccine. So the vaccine, it takes a portion, so it takes this mRNA that has basically the building blocks of the virus. So again, you're not getting the live virus like some of our vaccine gives you a little bit of a live virus, like measles, mumps, rubella vaccine gives you actually a live kind of what we call attenuated. So it doesn't make you as sick, but you're actually getting a piece of the virus in your body so that you can react to it. The mRNA and this vaccine here is a mRNA with a little piece of the virus. It's the piece of the virus that's going to go into your body. It has to deliver into your body in some way. So it's coded or carried into the body by what's called a lipid coating. So it's kind of water soluble, so it can actually get into your cell. The key is that it goes into the cells, but it doesn't go into the nucleus, which is the heart or the brain of your cell, where the DNA lives, okay? It comes into the outer part of the cell. Now, when that mRNA or that messenger RNA comes into your cell, it releases that little that mRNA with the little bit of the vaccine's code in it. Now, your body sees that virus code and says, hey, wait a minute, what is that? That doesn't belong in our bodies. And then proteins are made, right? The proteins are the key, because the proteins tell your body something is foreign, and then your body starts to make antibodies, right? Your soldiers start to line up like, okay, wait a minute, this is something foreign. We got to fight it. Let's get all of our soldiers together and get this thing out of our body. Once you have your antibodies built up, then let's say you're out now in the community and someone has coronavirus, they come into contact with you, then you're going to be less likely to get coronavirus and get sick from coronavirus, because your body has already seen that little bitty piece of the virus that was given to you from the vaccine. And now, as soon as that coronavirus enters your body, then your body's ready to fight. All your soldiers are lining up. 100% of your antibodies are lining up to fight this virus, and then you don't get sick. So that's how the vaccine works. What do you think, Pastor Wallace? Does that make sense?
That makes a whole lot of sense. And for a novice like myself, it's clearly understandable. And I can even share that with someone. And I thank you so much for making it plain for us today.
Yeah, that's great. And the other key is that once that mRNA does its job and creating the protein, it disintegrates in your body and leaves your body. So you don't actually have that mRNA still present in your body. That's the cool part about it. So that's the vaccine. And I hope that does encourage some people to get the vaccine. It is another tool that we have now to help fight the virus. Do you have any questions about that? Or you think you can give that message to someone?
No, I think I can amplify that message for sure. But I do have one question. And let's say, for instance, we're speaking to someone who have some of the underlying preconditions that we know are very susceptible to getting COVID-19. And they are concerned, how would this vaccine impact them with the other health challenges that they're dealing with? What will we say to them?
Yeah, that's a great question. And what we want to say is, like, they are the people that we definitely want to get vaccinated, because we know for a fact that the coronavirus, getting the actual disease, is extremely dangerous for people who have comorbid conditions, high blood pressure, diabetes, asthma, COPD, obesity. All of these people puts them at a higher risk for getting very sick if they get coronavirus. So the vaccine, because it's, again, not a live virus, it's not a live piece of the virus, it's a very small, really, protein of the virus. You're not actually getting the virus. You're getting just the kind of coating of the virus enough so that your body recognizes these proteins as foreign. And then when those proteins that are on the actual virus come into contact with you, that your body already has seen it and will fight it. So those are the people who need to get the vaccine even more than those of us who don't have any comorbid conditions. Hello, Pastor Zachary.
Yes.
Yes.
Hello.
Dr. Donna.
Thank you so much for joining.
No problem. I see you have that other pastor from West Oakland on. Why do you need him on when you have me? I mean, what is he? Hey, Pastor Wallace, how you doing?
I'm doing great, brother. How you doing?
Great.
Yes.
Great.
So Pastor Wallace and I were talking about the importance of pastors in our community as working as amplifiers of amplifying the message, so that the more you all are educated from health professionals, the more you can spread the message and let members of your congregation know. Because Pastor Zach, I laugh with you all the time that if I want something important, I want the members to hear it and do it. What do I do?
I don't know. What do you do?
I tell you. I tell you to say it.
And then Pastor Wallace, you start acting like now you think you're a doctor. Yeah, I am. I'm very good doctor. I got a little doctor in me now.
That's right. You're a great amplifier. So,
Yes.
Pastor Zach, are you hearing anything out in the community about the vaccine? What are people saying to you? What can we talk about tonight that will help people to lean more into vaccines?
Well, the conspiracy theorists are out. And my thought on the vaccine is if you don't want to take it, then you should keep that to yourself. You don't have to convince other people not to take it because you don't want it. And so I think that's what we're fighting in the community right now. There's a lot of naysayers talking about they don't want the vaccine, but that's all I've been hearing up to this point.
Yeah, so the more of us who get the vaccine, the more we can move towards herd immunity. Have you heard that phrase, Pastor Wallace?
Yes.
Herd immunity, you guys have heard it. Herd immunity is basically saying enough of us got the vaccine in the community that it protects not only us who got the vaccine, but also protects those people who chose not to have the vaccine. Now, taking the vaccine is a personal choice. We're presenting the information, trying to let people know about the vaccine. But if you want to take it or don't want to take it, it is a personal choice. I don't want you to not take it because you didn't have the information that you needed. Once you have the information, you can make an educated choice and decision to not get the vaccine. But the more people who are vaccinated in our community, the less likely it is that the coronavirus can continue to spread in our community because there's lots of us who are vaccinated. So it's like I'm a house, right? And I fireproof my house. Pastor Wallace, you fireproof your house, but Pastor Zach lives in between us and he decides it's too much money, so he doesn't want to fireproof his house, right?
Very good analogy. Very good. I like that.
So the fire comes in our community, right? And starts jumping from house to house. But because my house is fireproofed, my house won't burn. And Pastor Wallace, because your house is fireproof, your house won't burn. And guess what? Because your house is fireproof and my house is fireproof, Pastor Zach's house also won't burn because of the protection of those around him. And that's the same with the vaccine. I'm vaccinated and you're vaccinated. You come into contact with people who are not vaccinated. They come into your environment. You're going to be less likely to get it because you're vaccinated, and so are all of these people around you. So that's what the herd immunity is, getting enough people in the community to be vaccinated so that the virus doesn't really have anywhere to go. Yes, sir.
I have a question. With respect to herd immunity, I have read different counts where they say it needs to be between 75 and 85% of the population or a given community for it to really be effective. And that's the first question, is that true? And then secondly, from my understanding, most scientists are saying we probably will not arrive there until May or June of this year. And it's only once we reach that threshold that we can get to some degree of normalcy. Is that accurate?
Yes, both of those statements are accurate. We need somewhere between 70 and 85% of the community basically everybody in the world, right, to take this vaccine. 70 to 85% need to be vaccinated for us to get to herd immunity. 50% is not going to be enough. So we have to get closer to that 70%. If we can get into the 80s, that's going to be even better. So the more people who are vaccinated, the more likely we're going to have herd immunity. So yes,
but we do know that that's not going to happen this year.
Well, that's my second part. Go ahead, Pastor Zach. Go ahead. I was getting ready to say that. You see, amplifier, Pastor Wallace, amplifier.
Pastor Wallace, some news. If they vaccinate 1 million people per week, and we go 39 weeks out, that's still just 39 million people. That's not 70% or 80% of the population. So realistically, we might not get to that number until 2022.
That's right. Pastor Zach has been listening. Yes, we are not probably going to be in what we call a normal. We're never going to go back to being how we were before. I think that we are forever changed by this virus. But in order for us to sort of open back up, it's going to take some time because, number one, the federal government did a very, very, very poor rollout of the vaccine. So the number of vaccines that we were expecting to get right now as we're starting to vaccinate, we didn't get. So right now we're still trying to vaccinate our frontline workers, the doctors and other healthcare workers. And then next in line for the vaccine are supposed to be people who are 75 and older who live in congregate settings. So residential homes, nursing facilities, those types of nursing homes, those are the people that are next in line. And then who's supposed to be next in line are those who are incarcerated. Now, this is the state of California. Every state created their own tier system, their own phases of who should be in phase 1, phase 2, phase 3. For the state of California is what I'm talking about. Our phase went healthcare workers, and then those who are living in congregate settings. And then the state moved up our incarcerated individuals, because we know our incarcerated individuals are just like living in a skilled nursing home, right? Where you're basically unable to get away from somebody next to you, right? You're in this setting and it's easy to pass the virus from person to person. So our incarcerated individuals have moved up in order to get the vaccine. And then who's next is anybody who's over 65 who has comorbid conditions. Unfortunately, the number of doses of our vaccines we may not get all the way to 1D, which is the tier of 65 and older, anytime soon, because we didn't get the number of doses that we anticipated. The vaccine takes 2 doses to be fully vaccinated. Well, we want to make sure that the people who got their first dose are also going to get their second dose. So right now, in our county and in our state, we're trying to figure out what are we going to do with the doses? How are we going to try to get everybody vaccinated? So to think that we're going to have herd immunity by June I think it would be miraculous. It would be miraculous. So we were thinking really more by the time herd immunity hits, probably late 2021 or early 2022.
So I have another question.
Yes.
Since Pastor Wallace had 2 questions, I'm gonna get my question in also. I have 2 questions for you, Dr. Donna. So my question is this. So you gave the analogy of the house on fire.
Yes.
Right. And what about in the house, you have 2 adults married or cohabitating together, and one decides to get the vaccine and the other does not? How is that situation going to play out? Because we had that conversation in a Bible study class last night on Tuesday night. So
right.
What do you think about that?
So obviously the person who's vaccinated is going to be protected against getting the disease. So we know that the vaccine is about 94 to 95% effective against getting the virus. So that if you come into contact with someone who has coronavirus, then there's only a 6 to 7% chance that you're going to get sick. That's really, really low. That's really, really good. So if you're in the household with someone who doesn't get vaccinated, the person who's vaccinated is going to be relatively and pretty well protected from the virus, even if the person, their mate, does not get vaccinated. Obviously, it's more ideal if they do, particularly if there's other people in the household, like small children, for example, because children are not even on they're nowhere in this vaccine puzzle right now, because we're still trying to get the doses for adults. this virus, the vaccine has not even been studied in children. So we're not looking at really having a vaccine that will go for anyone less than 16 until maybe late this year, early next year. So if you have people in the adults in the household, and we know from studies that adults spread the virus to children. So if you want to protect your children who can't get vaccinated right now because they weren't in the initial study, then both adults, all adults in the household should get vaccinated to protect themselves and to protect the children in their household. So I want to talk.
Thank you.
You're welcome. I want to talk about the 2 vaccines that are out. So you can put the slide up to compare the Moderna vaccine to the Pfizer vaccine, which are 2 vaccines that we have. Now, I just want to, again, give a little bit of information so you can share with people, because I know a lot of people are saying, well, how many people were in the trial and how many Black people were in the trial and wasn't enough Black people. But let me tell you this. There is not one high blood pressure medication, not one insulin pill, insulin or pill for diabetes or heart disease or any of the other medications that we take in the Black community that has been studied with many, many participants from the Black community. Not one medication, not one aspirin, not one ibuprofen, nothing. Because we don't trust scientists. We're not going to run out for a clinical trial. So this vaccine trial is really no different from all the other medications that we take where there has not been an ample representation of Black people. Some of our medications that we take didn't even have women in the studies. Didn't have women, didn't have Black people, so I really want to say that so that people will stop saying that there weren't enough Black people in this study. There's no medication out there that had enough Black people in the study. Okay, so let's just get that out there. When you look at the 2 vaccines, Moderna and Pfizer, Pfizer had about 43,000 people in the study, Moderna about 30,000. They were clinical sites all across the world, not just in the United States, a lot of sites in the United States, but because this is a worldwide pandemic, there are clinical sites all across the world. If you look at the breakdown, about 70% were white, 10% about for every other ethnic group, 10% African Americans in about both studies. And when you look at the ages were, 50 plus. Again, not a lot of people, not a lot of studies that involve the younger population. They're just not running out to be study participants. And both studies do not have children. So Pfizer had the youngest participant at 16 years old. But basically, anyone less than 18 is not included in this study. So we can't give that vaccine to anyone less than really 16 for Pfizer, but safely 18 years old for both. Both of the vaccines take two doses in order to be completely effective. One dose of the vaccine gets you about 50% effective. 2 doses gets you to that 94, 95%. So you really have to take both doses. Both of them are between 3 and 4 weeks between your shot number 1 and your shot number 2. So I just wanted to lay that out there to kind of give some information for people to say, well, what did the studies look like? Who was in the study? But the main thing is to say, hey, Black people are not amply represented in almost any medication or anything that we use in healthcare. So take that argument off the table. Can I get an amen? Can I get a what? All right. Any questions about the studies and the vaccine?
What?
All right. So I wanted to just share that with you and to make sure that we are all on the same page about the vaccine, the studies, and who it's impacting. We are going to have studies and likely a vaccine for kids, but it's not going to be until much later, as we are very protective of our babies and our children. So, Pastor Wallace, any questions about the vaccine or anything come up for you while I was talking?
Yes. Another thing with respect to the vaccine, is there any other studies or vaccines on the horizon that's different than the two that we currently have, that might only would require a person to have only one injection?
Yes, there are about 7 to 8 other vaccines that are on the horizon that are in various stages of development. There is one that has just one dose, and we are kind of keeping our fingers crossed that it has good efficacy. It hasn't gotten to as far as being in what's called the phase 3 trial, where we can see big numbers of people who have taken this one particular vaccine, and then to look at how efficient it is in killing the virus. So we're waiting for that vaccine. But over the next year, I think there are going to be a number of other vaccines that are coming out. And hopefully the one vaccine that is a one-dose vaccine, hopefully that vaccine has a good 94, 95 or better efficacy against killing the virus. And then we can kind of move towards that vaccine. But it's not here yet, and it's not, it's not it's on the horizon, but way down the road.
Sure. The other question is, many people have tied vaccine to getting back to opening up society and economy and churches, for us to be able to come back and congregate. What is your thoughts on that piece?
Yeah.
And how critical do you think individuals getting closer to herd community are individuals who take it? Do you think how critical is that to us, to get to some degree of normalcy, of being able to even come together as believers?
Yeah, I think it's imperative that we get there, because without that protection, then we're just left with masks, distancing, and hand washing as our ways to battle this virus. And this virus has shown us that it is social. It likes hanging out when you hang out. So when there are groups of people, it likes that. It likes to spread and jump from person to person. We also see that this virus is doing what all viruses do, which is mutate, right? It wants to remain alive just as much as we do. So when they see things that are like, oh, wait a minute, I'm not getting as many people sick as I used to. Let me just make a little tweak and a little change over here and see if that will work. And we saw the strains that are coming out of South Africa and the strains that are coming, out of Europe, that those strains have a higher, they're more contagious, right? They're not necessarily making people sicker, but they're easier to spread. So without having something that's actually getting to the virus and killing the virus, we're going to be what we're doing now, apart from one another. So I think it's imperative that we have this vaccine, because that's how we're going to be able to come back together in fellowship. Yeah, so encourage your members to think about taking the vaccine. I get that question. I'm sure you get it a lot. Like, when are we coming back to church? When are we going to be able to open up church? And it really, really depends on how well we stop this virus from passing to one another. And the best way we have to do that right now is with the vaccine.
And also, in correlation with that, due to the fact that COVID-19 is disproportionately impacting and affecting people of color, particularly Black and brown communities, I think it underscores a need, because we are losing literally generations of people.
Right.
The hospitalization system and the medical system is at the brink in California, particularly in Southern California.
Yes.
We're seeing the death rate soar in our community. Many people are burying their loved ones. And as a result, I think we have to sound the alarm, doing all that we can to prevent that.
Yes, absolutely. Absolutely. So, Pastor Wallace, thank you so much for joining. I want to give you an opportunity. Are there any last questions that you want to ask, or
No, you have
topics?
covered everything for me. I feel much more informed, and I can share
Great.
this information with others.
Great. Fantastic. So the last slide I want to put up is for testing. Again, testing at your location. So you have free coronavirus testing for those of you out there who need to get a test, want to get a test. There was testing today, but there's testing next week from 10 a.m. to 3:30 at Mount Zion Missionary Baptist Church. Make sure you don't have to register, right, Pastor Wallace?
That's correct.
So you just
And we're gonna go all the way to the end of March with the Thursday testing. So every week on Thursday between those hours of 10 and 3:30, please feel free to come by. There's no pre-registration. There's no insurance needed. There's no cost. You can do drive-through, so you do not have to get out your car, or you can walk up and you can be in and out in 10 minutes and on your way. It's absolutely critical that we spread the word and that we in our community take advantage of this. Because I'm looking today, we probably made up about 15% of the people that came through.
wow.
Which is a little bit low. 2 weeks ago, we were over 75% of the people that came through right before Christmas. And then right before New Year's, our numbers was great again. Today, we served a lot of people. We didn't serve a lot of people from the Black and brown community today. So others are getting the word and they're spreading it through their community and taking advantage of this opportunity. We need to make sure that we do the same.
Right. Absolutely. So we want to make sure if you need to get a test, if you're concerned about it, you've been out hanging out, you want to make sure that you don't have the virus. And it's so important that you know if you're doing things that are going to cause the virus to be able to spread, it is important that you get tested for the sake of your loved ones that you might live with. You know, the 18, like I showed you, the 18 to, 30-year-olds are still hanging out. I did a room in this app called Clubhouse. Have you heard of Clubhouse?
No.
So it's this social app that's just a talking app where you go into these rooms and you just have conversations. And so I did a Clubhouse room with one of the young adults from my church. And lots of young adults on there, all in that age group of 18 to 30. And we had a great conversation. And I was informed about all the things that they're out there doing, hanging out, flying to Atlanta, hanging out in LA. And I was like, stop, don't do it. So the more we talk to people, the more we can let people know what's going on, the more we hopefully can get a handle on this virus. There's also some resources that I will put on my YouTube channel where you can actually sign up with the Alameda County Public Health Department. Let them know that you're interested in knowing when the vaccine is available for you in particular. So I talked about these phases. When it's your turn, they can notify you by email or phone to let you know, hey, it's your turn to get a vaccine, and this is where you can get vaccines at. I'll put that on the taping of this show. You had another question, Pastor Wallace?
Just one other point I wanted to mention.
Yes.
As you are aware that we have individuals who are partnering with you in doing the contact tracing.
My next
thing. And that is absolutely critical. Our people are calling to make sure that we try to get a handle on this. They're doing the contact tracing. It's very stressful because you're dealing with people who have just been exposed to this or potentially exposed. And so if you get those calls, cooperate with them because they're here to help you so that we can get list of individuals that you might have been exposed to or spreading it to so that we can try to get a handle on this. The whole thing is to try to make our community whole. And that's what we're working for in every front. Again, I want to thank you for the opportunity for us to work with you in that area.
Absolutely. Absolutely. You're a great amplifier, Pastor Wallace. So yes, there are people in our community. True Vine Ministries partner with Mount Zion and Greater St. John. We have a team of wonderful people who are making these calls. So if you get a call from someone from the public health department that says that you have been in contact with someone who has coronavirus or you yourself have coronavirus, please be nice. Please give us all the information. All we're trying to do is to prevent the spread of the disease. But we also can give you information information about where to get food, where to get stipends, where to get access to resources that will help you while you are quarantining. So thank you for the shout out, Pastor Wallace,
Yes.
and shout out to all of our case investigators who are in Team West Oakland. You guys are doing an awesome job.
Yes.
All right. Well, thank you again, Pastor Wallace, Pastor Zach. Thank you for joining. This is Talking with Dr. Donna. Every Thursday, I'm here to bring you message and information about how to create generational health in our community. Remember, every Thursday at 6:30 p.m., you have an appointment with your doctor. Take care. Be well. Be safe. If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you.